So right now we know that she does. She has a significant weakness. We're going to start at the trunk and work our way to the branches. Now we're going to use the Erchonia XLR8 for this example. You can use any of the Erchonia lasers, whether you have the PL Touch, the Base Station, the EVRL, any of them will work, but just for this process, we're going to use the XLR8. The frequencies that you can use, the standard 9, 16, 42, and 53, you can never go wrong using those for any purpose of upregulation. And this is a form of upregulation that we're going to be doing. However, sharing with you what other practitioners will use as well, neurogenic inflammation is one of the most popular settings used. And the people that I know that are absolute soft tissue specialists, they say hands down they get the absolute best results using that. And so you'll find that in your A to Z manual, but that is 9, 16, 33, and 36. So as we go through these primary areas, we're going to look at the cervicals. We're then going to go to the brachial plexus, where there's a superhighway of nerves coming out of the SCM and scalene area and coming down to the arm. Then we're going to look at the coracobrachialis muscle and how the musculocutaneous nerve comes through there. And then we're going to go to the posterior portion of the body on the scapula. And we're going to be looking at the axillary nerve and how it passes through the quadrilateral space, how we're going to look through just below that, the triangular space, and then how we're going to use the ulnar nerve. And then as we get into the median nerve, we're going to look at where the rotators are applied, so just right past the elbow crease. We're going to start looking at the pronator and supinator muscles. Here's how we use the laser, and then we're going to come down a little bit all the way to the wrist area itself. So these are going to be the primary areas we're going to use. So I'm going to position my laser in the stand. So in this situation, because you're going to keep rechecking the indicator, you're really going to want to use the stand, and even the patient's going to help us at times as well. So I'm just going to turn the laser on. Now lasers are very forgiving, but when you're dealing with peripheral entrapments, you will find that just moving the laser literally sometimes a ½ inch or an inch, you'll get a different response, because we really need to concentrate that energy over the area.